welcome to the 10th annual Love Event. We look forward today to tell you a little bit about what Donor Egg Bank USA has been up to, as well as to celebrate excellence in the laboratory and in patient care this year. I'm Heidi Hayes. This is Wayne Caswell.
Hello.
And let's get started. Okay, we're just waiting for the first slide to advance. Don't you love technology? Okay, let's move forward. So we had a landmark this year. We hit the milestone of 10,000 egg warmings. We did that on June 25th, 2021, and we're so excited to have done that with you.
We couldn't have made this milestone without your individual excellence and your confidence in us to provide the best vitrified eggs available. Thank you so much.
So some of the activities we've been up to this year, we currently are shipping eggs to 280 fertility practices in 10 countries. We have a small but mighty team in which 7 languages are spoken, so we can take care of your patient in the language that they prefer. We have 2 nurses as our physician relations liaisons. We launched 3 new financial plans this year, and we are excited to be doing some really amazing research with really prestigious fertility practices here in the United States and some amazing institutions. And once again, we are traveling to visit you. We have more than 300 donors currently on our database. We want to just not meet the standard. We always want to exceed it. And we're doing some great things in our screening process to make sure that you're getting the highest quality eggs. One of the things we've done this year is we have expanded internationally, and we've also opened up a couple new domestic locations. Our goal is to make sure that your patients have a diverse database and that we can maintain the affordability of working with Donor Egg Bank USA. In our international programs in particular, we've added heightened due diligence. We're doing quality controls there. We're doing frequent audits. We've actually been to visit them. And I will let you know, we're getting amazing results from those fertility practices. Let's go to what's most important to all of you, our quality. We're going to start by really looking at our overall statistics, followed by the vitrification side, the cooling side of the house.
Thank you, Heidi. So you all know us here at Donor Egg Bank USA. We pride ourselves in our transparency. So this slide here is showing you many of our primary indicators we use. We're presenting our 2020 data set, and some of the highlights on that data set we'll talk about in a moment. We also have the all-time data here, and as always, the top 10%. We show you the averages, but none of us want to be average. We all want to be excellent. So if we look at number of eggs embryo transferred on average, we're still maintaining a 1.1. So ESET really is the standard, and we love to see that. Our blast conversion rate in 2020 was 53% per FERT. But if you look in our top 10 performing groups, you see it's as high as 58%. So getting a blastocyst is the first hurdle, so we have something to transfer. But then we need to get the pregnancies. If you look at our clinical pregnancy rate in 2020, you'll see we had a 62% clinical pregnancy rate on average. But in our top 10 percentile, they had as high as 78%. One of the questions I get asked often about this top 10 percentile group is how influenced is that by the application of PGTA? And actually in this data set, we're showing you less than 10% of those cases had PGTA applied. So I'm showing you here is our survival rate year over year. If you've seen this slide before, you know in the first few years we had a declining trend that we had to address. And we addressed it by modifying our protocols and increasing our training. I'm really proud that over the last 4 years, we've maintained a 90% or better survival rate.
So we're going to move on to the first set of awards. We know that when we have great survival, it really comes down to how well those eggs are vitrified to begin with. So at this moment, we'd like to ask all the co-conspirators at the fertility practices to go ahead and turn your video on so that we can highlight you if you're on camera. We're going to look at this from the 5th place position to the 1st place position. And we actually have several ties this year. So in the 5th place position tied, the award goes to Cindy Schweitzer, Shady Grove Fertility, Atlanta.
Cindy at Shady Grove Fertility Atlanta has been a relatively new program freezing for us. So to achieve a 60% pregnancy rate per transfer is quite the accomplishment. Congratulations, Cindy. We're so happy to be able to recognize you.
In our other 5th place, we have Yvonne Arthur, Fertility Institute of Hawaii.
Fertility Institute of Hawaii is routinely on our leaderboard for freezing, and we're glad to continue to have somebody representing there. Yvonne Arthur has been an award recipient in the past, and a 60% clinical pregnancy rate is quite the accomplishment. Congratulations to Yvonne and to Fertility Institute of Hawaii.
In the 4th place position is Amber Brewer of Arizona Reproductive Medicine Specialist.
Those of you who have seen these awards before are very familiar with Amber. She's always on the leaderboard, and we're happy to see that she continues to be a consistent performer in a very high volume freezer. So Amber, congratulations to you, and thank you for working with us.
In our 3rd place position, the winner is Sabrina Mattingly from Arizona Reproductive Medicine Specialist, and now with Carolina Conceptions.
So this is great. This is actually somebody that was trained by Amber. So Sabrina has now moved on to Carolina, and we see Dr. Parr is here to receive the award, but congratulations to Carolina Conceptions and Sabrina. Job well done with a pregnancy rate of 64.3%. Outstanding.
In our 2nd position, the winner is Erin Wilcox of Utah Fertility Center.
Utah Fertility Center has often been on our leaderboard, but this is the first time we've recognized Erin. So outstanding work with a clinical pregnancy rate of 65.8%. Congratulations to Erin and the whole team at Utah Fertility Center. Job well done.
Okay, so our 1st place winner is tied. We have 2 1st place winners. The first winner goes to Jim Graham, Shady Grove Fertility, Rockville.
Jim Graham, another longtime winner and great performer. We're very happy to have him as part of our team with a clinical pregnancy rate of 66.7%. Is the Rockville team. Congratulations.
This other 1st place winner is Melissa Johnson of Idaho Center for Reproductive Medicine.
So we're really happy to recognize Melissa here with a clinical pregnancy rate of 66.7. Idaho Center has been freezing for us for a couple of years, but they've been a consistent and well done performer. Good job.
So the U.S. Freeze Clinic for 2021 is Nevada Center for Reproductive Medicine.
So Nevada Center, this is quite the accomplishment where none of your individual people were recognized, but the fact that you have a good team shows that you guys can produce good results. Outstanding result of 75%, reflective of a great team. Well done.
Okay, so we know that it takes great eggs to be vitrified in order to get great warming results. So we're going to look at the 2021 financial plans that we launched and a little change we're going to make in the guarantee. So first of all, let me just remind you, the Assured Refund Plan has been offered since 2012. It is our most popular plan. It offers that live birth or a 100% refund. The treatment is guaranteed as well as the eggs, and you, the practice, take zero risk with this plan. But new in 2021, we offered the multi-egg lot refund plan. What we're finding is that more patients have insurance that will cover a portion of or even all of the treatment. So this plan, like the Assured Refund Plan, really gives them the 100% refund if they're not successful, but allows them to have a take-home baby and with up to 4 egg lots to do so. Every egg lot we provide has a blastocyst guarantee, and that's a usable quality blastocyst available for transfer, freeze, or biopsy. We're making a slight modification to the guarantee this year, and the Physician Insider will be out to you in just a few weeks' time, and you'll be able to actually review all of our reasoning for this guarantee modification. but Wayne's going to cover it quickly.
So the modification we're going to make is to the male side of the equation. We're going to maintain the 1 million total motile count required in the male ejaculate to be eligible for the blast guarantee. We're going to remove the surgically retrieved sperm, whether it be epididymal or testicular. Now, we will consider replacement requests that use epididymal or testicular sperm, but in those reviews, we're going to focus only on oocyte performance. If we feel the oocytes contributed to the fact that no blastocyst was produced, then we may offer a replacement lot.
Couple other changes. The first is in our euploid quality guarantee that we began offering in January of 2021. We heard you. The original guarantee restricted the reference laboratory that you were able to utilize for your patients. We're removing that as of now. You can utilize any reference laboratory that you like. This will give your patient up to 3 egg lots in their quest for a euploid blastocyst. We're not big proponents of PGTA, but if the physician wants that for their patient, we stand behind you 100%. Also, with our genetic carrier screening, we're going to hold the current level of the panel until you request us to expand it. We know expanded panels are coming in the future. One of the things we're going to do as of January is we're going to begin accepting cystic fibrosis carriers in our donor population. We really feel that science has evolved to be able to do this safely. But if for some reason your fertility practice would like to have those donors blocked from your patient view, just let us know. We can do that for you. So let's review the vitrification warming statistics, and then we'll follow that with the awards.
So we talked before, the survival rate's above 90%, so that means we have good eggs available. But what really matters is blastocyst conversion. So if you look at the green line here, I'm showing 2016 to 2020. The reason I started with 2016 is this is really when blast transfer became the standard with the vitrified donor eggs. And you can see we've maintained a greater than 50% conversion rate year over year. One blast really isn't the goal. We'd love to get more. And you can see on the blue line, excess vit rate has been on an upward trend. In last year, almost 71% of recipients had more than one blast available within their egg lot. So we're really happy to see that trend, and hopefully it'll continue in the future. This slide is showing both ongoing and clinical pregnancy rates year over year. And you can see there's been not as steep as we'd like, but a steady increase year over year. So we're really happy that we're seeing that, and it's a testament really to the performance of the laboratories that choose our eggs. Excellent work provides excellent results. So we're really happy to share this with you.
Okay, so let's get to the exciting part. What we've done this year is we've broken the warming awards into 2 categories. Some of the clinics in 2020 closed during COVID, and we wanted them to still be recognized for great results. So the first category is an N 10 through 14. The second category that we're going to go through would be an N equal to or greater than 15. So again, I'm going to ask the co-conspirators to please turn on your videos so that we can recognize your winners. So for superior outcomes in egg vitrification warming, in the 5th place, we have Adrian Rain from Institute for Reproductive Medicine and Science.
Adrian, great job. This is a fairly new group with us, been working with us, but a 75% pregnancy rate, absolutely outstanding.
In the 4th place position, the winner is Mariana Pontos, Fertility Centers of Illinois, River North.
Marina, we're very happy to award this to you this year. Fertility Center of Illinois, both the River North and Highland Park have been on the leaderboard before, so we're happy to see you guys here with a clinical pregnancy rate of 78.6%, incredibly noteworthy.
In the 3rd place position, the winner is Oleski Barash from Reproductive Science Center of the Bay Area.
First time award for Oleski, congratulations. But Reproductive Science Center of the Bay Area have been on the leaderboard before. So excellent, we're so happy to recognize you and share this with you. Clinical pregnancy rate of 80%, outstanding.
It's great to see the winners celebrating.
Absolutely.
In the 2nd place position, the winner is Luis Colturato, Shady Grove Fertility, Rockville.
Louise, first-time winner at Shady Grove with a clinical pregnancy rate of 88.9%. Everyone should follow whatever Louise is doing. It's working. Good job, guys.
Oh my gosh, these clinical pregnancy rates are just amazing. And the number one position, the winner is Sean Zimmerman from Vios Fertility Institute, Swansea.
Another one to follow and copy and keep an eye on, a 90% clinical pregnancy rate with Sean in the Vios team in Swansea. Great job. Should be really proud of yourselves. We certainly are proud of you.
So now let's look at the winners with an N greater than or equal to 15. In the 5th place position, the winner is Maria Hermosa from Reproductive Partners Medical Group.
Congratulations, Maria. Another long-term partner with us. Really happy to recognize you with a 61.9% clinical pregnancy rate. Job well done.
We'll give them just a minute to celebrate.
Absolutely.
In the 4th place position, the winner is Marie Baldwin from Boston IVF.
Boston IVF has been represented on this board before, and we're really happy to recognize Marie with a 62.9% clinical pregnancy rate. Job well done. We'll see you on the leaderboard next year. Good job.
In the 3rd place position, the winner is Jianqi Ding from Fertility Associates of Memphis.
Dr. Ding won the award last year as well, so a repeat winner with a clinical pregnancy rate of 64.7%. Just a great job, Dr. Ding. We love working with you.
In our 2nd place, the winner is Shelby Gilbert, IVF Florida Reproductive Associates.
Shelby, first-time winner from the IVF Florida Reproductive Group. Outstanding work, 67.9%. Congratulations. We're happy to be able to share this award with you, and thank you for choosing to work with us.
Great job, Shelby. In our 1st place for superior outcomes in egg vitrification warming, the winner is Erica Paganetti from Reproductive Medicine Associates of Connecticut.
We're really happy to recognize Erica here with this group with a 76.2% clinical pregnancy rate. Just outstanding. You're doing it right, and we love working with you. Keep it up.
Congratulations. So the USA Warming Clinic 2021, the practice award is tied, believe it or not. We have 2. So the first one is Shady Grove Fertility, Fairfax.
Shady Grove Fertility, Fairfax. We started off a little rough, but you guys really nailed it. 66.7% clinical pregnancy rate. Outstanding. We're so proud that you guys are working with us. You guys do great work, and let's keep it up.
And I just want to add again, this is a little like the Nevada Center for Reproductive Medicine. Not one individual really carried this program. It was a full team effort of high quality throughout all the embryologists in that lab. Really, really well done. Our other practice award with a tied percentage result goes to Reproductive Medicine Associates of Connecticut.
Again, a very good and noteworthy accomplishment from this group. 66.7% pregnancy rate. Really outstanding. We're really happy to acknowledge you guys, and you're a great partner.
So behind every great laboratory and every wonderful physician, of course, is an amazing clinical care team. We really love working with these men and women that hold your patient's hands through the entire process. They make sure they get the excellent care they need, and really help these patients like hang in there and persevere so that we can get them pregnant with a baby. So this year's Love Award for Excellence in Patient Care 2021 goes to Catherine Blodgett, who's a nurse at RMA of New Jersey.
Catherine, all we hear is great things about you. You put your patients first, and we're so happy to be able to recognize you and the team at RMA of New Jersey. You guys are excellent partners, and we're so glad that you choose to work with us.
And the Donor Egg Bank USA team here rave about you. Our team loves working with you. And we're just thank you for your partnership and your camaraderie as we really work with your patients. So we want to thank you for batting beyond 10,000 egg warmings with us. Let's see what we can do for the rest of 2021 and into 2022. It's really your excellence, your achievements, your quality that makes Donor Egg Bank USA a wonderful program to work with. We're grateful for your partnership, and we look forward to working with you and helping families around the globe.
Thank you for working with us. We really appreciate your partnership. Let's have a great 2021.